So today I'm talking about the anatomical study of the lymphatic system in the historical aspect and also the technical aspect. So that's my today's presentation. So it's a couple of years ago before the COVID. So I visited to the Anatomical Museum in Vienna, and then I saw the life-size wax model, wax model. It's displayed in Anatomical Museum. So this model is created by the Italian people in the 18th century. It's quite amazingly detailed and then quite accurate. And then one of the anatomists is Paolo Mascagni is helped to create in this anatomical wax model. And then we don't know much about how the people are investigating the anatomical study of the lymphatic system. I just briefly introducing how the anatomist is investigating the lymphatic system. So the discovery of the lymphatic system is credited by the Italian anatomist named Gasparo Aselli in the 17th century. What he did is, so he dissected the living dog, and then by chance can see the white cord on the mesentery. And then when he cut by this white cord by the scissors, and then suddenly the white liquid comes out. And then he thought this is something, it's a new circulatory system, and also it's related to the absorption. So the method is to dissecting the living animal. But its technical advancement is achieved by the Anton Nuck, a Romanian anatomist. What he finds is mercury could be the good material to demonstrating the lymphatic system. In that time, the anatomist using the mercury for demonstrating the vascular system. And then, so the mercury is very slippery material. And then, so the small amount of the mercury can spread it into the entire vascular system. So that's why it's not surprising the Anton Nuck used mercury for the demonstrating the lymphatic system. And then, so according to his achievement, so the next 300 years, so the anatomist using mercury for demonstrating the lymphatic system. So one of the famous diagram of the lymphatics is made by the anatomy professor in the University of Paris, is Sapi. So his diagram in the trunk lymphatic is showing the demarcation between the sagittal midline and also the horizontal chest or back as it's going to the actual lymph node. So, but it's quite artistic. It's for the anatomically, so may not be truly accurate. Probably one of the reason is this is not like the dissection from not only the one specimen, it could be the montage of the couple of the specimen. And then afterwards, so the anatomist realized the mercury is a toxic material, and then switch the mercury to the safe material. That's an oil painting dye. It's called the Gerotaz method. So injecting the oil painting dye to the cadaver specimen. But the mercury is running in travel the long distance, but the oil painting color traveling a short distance. What's happened is anatomists switching the big adult human cadaver specimen to the small fetus specimen. So suddenly the illustration become like a child. It's not like adult. So using a dye injection method, it's a Professor Kihara in Japan, also investigating extensively about the deep lymphatic system. So the people already know the difference between the superficial system and the deep lymphatic system in the early 20th century. So, the using a fetus is a big limitation for the anatomical study, because now is it's not like a fetus is not like a easy specimen for the ethic issues. So that's why this is one of the reasons is anatomical study of the lymphatics is faded out for the last 100 years. So there is no much progress after the SAPI's age. And then the issue is, so the left side is the current diagram is Gray's anatomy. It's quite the well detailed. So then lymphatic drainage from the breast is drawn by the green line. But if you see all the material, so the one of the information missing in the Gray's anatomy, the lymphatic system in the torso. So this information is totally missing. It's sometimes wrongly demonstrated. So it's for the plastic surgeon, we really need to understanding what the accurate lymphatic anatomy is. So then I starting the anatomical study of the lymphatic in 2001. And then, so I published in a PRS in 2005. And then I find, so the hydrogen peroxide, very simple material, could be very suitable to demonstrate in the lymphatic system in the cadaver specimen. After injecting the hydrogen peroxide to the cadaver specimen, it's going to produce in the fine oxygen bubbles. So the fine oxygen bubbles is inflating the lymphatic vessel, could be identified from the surrounding tissue. There's a difficulty to identify the lymphatic system in a cadaver specimen is the lymphatic is collapsed, and also the lymph fluid is transparent. There is no red blood cell like a blood circulation. So that's why, but using the hydrogen peroxide can be, after the inflated, can be identified under the microscope. Because I have a microsurgical skill, and then I can cannulate into the electrode in the lymphatic system and then inject in the radio contrast media or the dye to demonstrate in the lymphatics. So after injecting the contrast media, so this is one of my dissected specimen in the forequarter, and then took the 3D CT to demonstrate in a 3D demonstration to understanding the relationship, the lymphatic from the arm and also the lymphatic from the torso. So this is a way how I define the lymphatic territory. First, injecting the contrast media into the lymphatic system. So then after making a one long incision, straight line, and then removing the soft tissue and then separated from the bone, and then spread it on a plastic sheet and then take the X-ray again. So now we can clearly see which lymphatic vessel connected to which lymph node. And then after finding the group of the lymph node, is attach the color to each lymph node. And then retrogradely attach the same color to the corresponding lymphatic vessel. So you can see, so in this specimen, green color vessel, the majority of the lymphatic vessel is actually connected to one lymph node in the lateral side of the axilla. But there is the other pathway is going to another lymph node. So then once identify the lymphatic territory and then attach to the color on the skin, and then finally wrap up to define the lymphatic territory in the area. And then I summarized my dissection and also reviewed many historical material, and then making a concept as a lymphosome, a skin territory which contained a superficial lymphatic channel connected to the group of the first lymph node. So this is a way, so I defined the demarcation of the lymphatic territory. So it's going to be the start to understanding, because to introducing the lymphatic system, especially for the lay people, because the people having a little understanding about the lymphatic system. So then after visit to the Japanese institution in 2007, including Tokyo University, which the Koshima previously running the plastic surgery department, I understood. So the Japanese doctor using extensively about the indocyanine green lymphography for the, especially for the lymphovenous operation. And then I installed this machine to the MD Anderson Cancer Center Hospital in 2009. and then started using this machine together with Professor David Chan. So prior to the lymphovenous anastomosis. And then what we find, so it's quite fascinating because now I start in the anatomical study of the lymphatics. I can see the similar picture in a clinical situation. And then we define the staging system depend on the amount of the dermal backflow area in the limb. So it's quite simple, but it's quite good to, I still using this staging system in our institution. So I work together with the Japanese group in Okayama University, especially the Dr. Shinaoka. And then we find, so that indocyanine green lymphography, it's not only you working in the live humans, also working in a cadaver specimen. And then we inject in the indocyanine green to the dead body, still working well to demonstrate in the lymphatic system. So I can show in a short video about my method. So this is not the live human, it's like the cadaver. So that's why I can inject the dye into the finger. So then after the injection, so it's similar to the patient. We can immediately see the lymphatic system. And then once I see the lymphatic system, I'm marking using skin markers. And then the dead specimen, there is no the force to facilitate in lymphatic, but the massage can facilitate in the movement of the indocyanine green dye inside of the lymphatic vessel. So this is after injection from the distal side, and then we can see the normal course of the lymphatic system like this one. And then here is a indocyanine lymphography in a cadaver arm. So this is a mapping. So we can see the normal course of the lymphatic system. And then once I then mapped out the lymphatics, and then I injected a mixture of the dye and the hydrogen peroxide. We already know the position of the lymphatic system, and then after the injection, making a skin incision. So making a big skin incision because this is not like the human case. And then similar to the LVA operation is carefully to peel off the skin, not to damage the lymphatic channel. So the inflated lymphatic channel can see like this way, and then small amount of the dye is inside the lymphatic system. And then once I identify the lymphatics, I'm using a 30 gauge needle to punch in directly into the lymphatics. Here is the tip of the needle is the inside of the lumen. And then I'm using a device called a micro manipulator to hold in the needle. And then very simple, just a small tube is connected, the 1 cc syringe is manually pumping to any agent directly into the lymphatic system. So the lymphatic can be demonstrating like this way. The difficulty of the lymphatic system is totally transparent, couldn't see it in the cadaver specimen. So then after cannulation and then injection in the dye, so demonstrating the lymphatic is pretty simple. So then I peel off the skin on the top layer of the lymphatic vessel. So then we can clearly see how the lymphatic is running in the cadaver specimen. So sometimes I'm using the injected cadaver specimen for the display for the scientific meeting, also the workshop in the lymphedema therapist. So now the lymphatic is connected to the actual lymph node. So this is the typical case of the dissected the arm specimen. And then you can see the lymphatic vessel like this, and then also the lymph node like this way. So understanding the normal lymphatic system is important. So the dominant lymphatic is connected to the lymph node in the axilla, but there's the half of the body having additional pathway straight to the clavicular lymph node. So this pathway is called the Mascagni route or Sappi's route, and then in the Switzerland, in the anatomist, the Dr. Kubik called the lateral bundle. So this is of importance to considering the lymphedema because of this lymphatic pathway skipping the axial lymph node. It doesn't affect any of the axial node dissection. And also the inside of the elbow, so there might be the natural connection between the superficial lymphatic vessel and the deep lymphatic system. So this part is also important because this lymphatic pathway is skipping the sentinel lymph node biopsy or level 1 lymph node dissection. So here is a case of the leg. So similar to the arm, we can see the course of the lymphatic vessel in the leg. And then here is a magnified picture showing the lymphatic vessel. Most of the lymphatic vessel running inside of the knee. And then here is the magnified picture in the inguinal lymph node region. And then working together, the Shinaoka did a further investigation about the subgrouping of the lymphosome. And then he found, so the fourth pathway is covering the lymphatic drainage in the lower leg. And then we published this result in the radiology. And then here is a diagram, a schematic diagram to show in a 4 different pathways. Injecting a different color of the dye, we can see how each pathway connected to which lymph node in the inguinal region. So similar to the arm, so most of the lymphatic vessel is dominant lymphatic drainage connected to the superficial inguinal lymph node. But in the posterior side, so the couple of the lymphatic vessel running next to the small saphenous vein and then connecting the popliteal lymph node and then reach to the deep lymphatics. And similar to the arm, there might be the natural connection between the superficial and the deep is existing into the inside of the knee. So the summary of my presentation is, so indocyanine in lymphography, not only for the live human, so could be demonstrating the lymphatic in the fresh cadaver specimen. So even the cadaver having no force to movement of the dye, but the external massage can helping to facilitating the indocyanine green movement. And then lymphatic mapping with indocyanine green is helped for the next microinjection procedure to minimizing the time of the dissection. And then demonstration, especially this is important, demonstration of the lymphatic in the cadaver model can be used as a normal anatomical template. Because it's difficult to study the lymphedema limb in the cadaver. So this knowledge of the normal anatomy can helping to interpret what's happened in the lymphedema in a patient. So thank you for your attention. Yeah, thank you for the invitation for me to having the chance to present my work. Thank you so much.
Yeah, thank you very much for a very, very informative lecture. So someone has a question. If you have a question, please write the Q&A. Or Harry, do you have some comment or question?
Yes.
Okay.
So excellent video and excellent presentation.
Thank you so much.
Yes. So I wanted to know if you have a degloving of the skin in traumatic situation, in degloving trauma, can you still inject into the hand and get such amount of clear images? Can you get in trauma situation?
So all the video is like a cadaver, But
Right.
the cadaver is much more difficult than the living
Yes.
human. So the living human is injecting the dye spontaneously uptake into the lymphatics. So
Correct.
that's why I think it's worth trying if you want to demonstrate in the lymphatics. So doesn't need any special technique. So the intradermal injection of the patent blue violet or the lymphozurin can easy to demonstrate in the lymphatic system. But having a knowledge of the normal anatomy could be the getting a good idea where going to inject and then what expect to see.